This is a topic that I think most people who use mouthwash would be very interested in. The title of this is The Most Effective and Least Expensive Mouthwash. Now, the two terms, least expensive and most effective, probably triggered your interest. Before we get involved with sodium hypochlorite as an oral rinse, let's have a little background and let's look at some information from the Center of Disease Control. In this reference, you will notice that sodium hypochlorite is used to make contaminated water potable or drinkable. And what they advocate doing on this, if the water is clear yet contaminated, they want to put 1/8 of a teaspoon of sodium hypochlorite to a gallon of water. Then you can drink that safely. However, if the water is cloudy, it needs to be a little stronger, and you put in 1/4 of a teaspoon of sodium hypochlorite. Again, you will note how weak this solution is. Most of the research on the use of sodium hypochlorite as an oral rinse has been done by Dr. Jorgen Slots of the University of Southern California. He's had several publications on this, and here is one that I might refer you to. Now, what he recommended was 0.05% sodium hypochlorite as an oral rinse. He recommended 3/4 of a teaspoon to 8 ounces of water 2 to 3 times a week. And he used plain and unscented sodium hypochlorite. But let's look at that 3/4 of a teaspoon, and let's look at the modification that I am recommended. First of all, 3/4 of a teaspoon to 8 ounces of water 2 to 3 times a week. And he was using this for treating periodontal disease. But let's look at the modification I'm talking about. I'm talking about 1 teaspoon to 32 ounces of water to be used every day in a healthy mouth or in a periodontally involved mouth. Now let's look at that. How do you measure 3/4 of a teaspoon? I think it's much easier to measure 1 teaspoon and look at the difference in the concentration. But I think mine works quite well. I've used it in my mouth for several years, and others using it have found the same impact that I have had. There are other advantages to using sodium hypochlorite. It will not stain the teeth, such as chlorhexidine rinses may do. It has substantivity, and let's talk a little bit about substantivity. If you put on oil, suntan oil, it adheres to the surface, and even though you go swimming and all, it will not rinse off. Now that's substantivity. This means that the property that it adheres to hard and soft surfaces cannot be removed by rinsing and remains effective over a period of time. Now, exactly how long sodium hypochlorite remains effective is not definitely known, but we do know that it has this wonderful property of substantivity, and since it is bleach, we know that it is not going to stain the teeth. As I said, chlorhexidine will. I would suggest that you look at this video because I think this is something that we need to better understand, and that's the difference between a periodontal pocket and a periodontal defect. Now, a periodontal pocket is infected, bleeds on probing, exhibits suppuration and inflammation. Now let's talk about the difference between a periodontal pocket and a periodontal defect. After treatment, some residual probing depth remains. However, it is not infected because it does not bleed on probing, does not exhibit suppuration or any significant inflammation, is stable over a long period of time, and that is very important, and exhibits no additional loss of attachment. In other words, it's stable, and radiographically there is crestal density. Now, practical considerations on that. This solution can be used in a water jet to treat pockets or residual periodontal defects, of which I have just defined. And what you can do is place 4 to 6 ounces in the reservoir of a water jet. But care should be taken when using this solution because it is bleach, it may splatter, and there may be some bleaching of clothing. How do you mix this? First of all, always use a measuring spoon. I don't want to be critical of my friend Jorgen Slots, but how do you measure 3/4 accurately of a teaspoon? And I'll have a short video at the end of this that shows you exactly how you do that. So here we see a teaspoon, and on the right we see a teaspoon on the top and a tablespoon on the bottom. And you do not want to use a tablespoon because more is not more effective. So this is the only thing that you need. A quart bottle, 32 ounces, and your little measuring device where you can accurately put in 1 teaspoon of sodium hypochlorite. But before using the solution, I would suggest that you look at this video on the importance of cleaning your tongue, which is using a tongue sweeper by Dr. Robert Rippich that you see here. Now, this solution, how do you use it, or how do you use this whole concept? First of all, use about 1 ounce of the solution and swish it between your teeth after brushing and interdental cleaning. Secondly, gargle to kill the bacteria and viral pathogens on the posterior third of the tongue, and then use the tongue scraper to scrape this solution into the posterior part of the tongue before rinsing out with plain water. And if you want to be very safe with this and be sure that you do not ingest any of it, I would suggest that you drink an 8-ounce glass of water following your oral disinfection. How effective is the water jet by removing plaque? This is somewhat of a controversial subject, and it all begins with the acquired pellicle. And this is a biofilm free of bacteria covering the oral hard and soft tissues. It is composed of mucins, glycoproteins, and other proteins. It begins to form 30 seconds after you brush. And so this is where the controversy comes in, because we know that the water pick will not remove the acquired pellicle. So here are 2 references that you can look up that talk about that. And for those that are checking your periodontal boards, perhaps you should be aware of these 2 references. But let's talk about how plaque forms and summarize briefly this schematic taken from the below article. Now, let's talk about the formation. Dental pellicle forms on the tooth, and loosely bacteria adhere to the surface. Second, within hours, bacteria loosely begins to attach to the pellicle, and they begin to proliferate throughout the mouth, and then we have a mature plaque. And the other 2 or 3 things on here you can look at all the way to calculus formation. But let's go back to the dental water jet, and I think this is a significant article that goes back many, many years, and I think needs to be revisited. Because moderate hydraulic forces produced by the dental water jet can significantly remove the biofilm. That's the bacteria, their toxins and all, but remember, it will not remove the acquired pellicle, and this is where some people had a problem with this. But by using the water irrigator on residual defects, which we've talked about earlier, the solution is forced deeper subgingivally. And common sense says that if we placed the sodium hypochlorite in the water pick, we could continue more effectively disinfecting the periodontal defect. Does the solution degrade over time? And this is something that I've added on this video because I've done a little further research on it. In the older video, I said I do not know how long this takes, but we do know that solution begins to degrade after 24 hours. But how long it takes to become completely inactive, I do not know. So here's an article that discusses everything that you want to know about the bleach and were afraid to ask. Let's talk about practical considerations. If you use the solution daily, I suggest that you prepare a new solution at least once a week. Yes, it will begin breaking down at 24 hours, but the effectiveness of it is still present, at least I have found in my mouth, as well as others have found at the end of a week. So therefore, I suggest that you mix up a new solution at least once a week. But if we're going to use a solution, obviously we need to have a disclaimer on it. This information is being provided for educational purposes only, and the solution should only be used at your own risk. Secondly, this is not a prescription, and as I said earlier, the solution should only be used at your own risk. Third, under no circumstances should it be swallowed. That's why I suggest that you drink an 8-ounce glass of water after you have done your oral decontamination. Obviously, children should not use a solution because they may be careless and swallow it, and certainly expectant mothers or women who are considering becoming pregnant should not use a solution, as the impact on the developing fetus is not known. But what are the side effects of using sodium hypochlorite? Drinking bleach can cause effects that range from slight to moderate, depending on the amount ingested. MedPlus states that the consuming, and note it says here, diluted bleach or sodium hypochlorite may lead to minor irritation. Ingesting larger amounts can lead to gagging, sensation of burning in the throat or the esophagus, chronic chest pains, low blood pressure, slow heart rate, delirium, coma, shock, vomiting, things like that. And perhaps we should even add death to that. But remember, using the solution as weak as I have suggested and following this with an 8-ounce glass of water, this should not be a problem. Now let's go to the short video on exactly how to measure 1 teaspoon of sodium hypochlorite. Now I want to demonstrate to you exactly how to mix up 1 teaspoon of sodium hypochlorite. I want you to note that I have a measuring cup in which I'm going to pour the sodium hypochlorite. And you will notice the solution in the bottom. Then we take a teaspoon, and you can see the difference between the size of a teaspoon and a tablespoon, and we want to use a teaspoon. Now we have our sodium hypochlorite. We tip it slightly and take a teaspoon and put it in there, and you will notice that I'm taking out a level amount and am going to place that in a quart jar. Then you simply add water to it, and you have exactly 1 teaspoon to a quart of water. Now that we have shown you exactly how to mix a solution to get exactly the right proportion and strength, I want to refer you to this video on the importance of disinfecting the tongue. I've alluded to the fact of using the tongue sweeper by Dr. Rippage, and this video will go a little more in depth on exactly how we do this. First of all, you cannot brush the posterior part of your tongue without gagging. Secondly, using a wet toothbrush simply smears that bacteria around and will go ahead and gag you. The following video that you see here will show you exactly how to place the tongue sweeper, exactly how to scrape, and so forth. So look at that as a follow-up to the information that you have learned in this current video.